So today we're going to talk about SIRS and sepsis. What is SIRS? It is Systemic Inflammatory Response Syndrome. It is the beginning stage of sepsis and the systemic response to a wide range of stressors. Two or more of the following must be present, and those must be alterations from the baseline. So if somebody's heart rate is normally 100, that would obviously not be one of the included criteria. So you would have to go to, okay, are their respirations greater than 20? Is their PaCO2 less than 32? So the criteria are a temperature greater than 38 degrees centigrade, or 100.4 Fahrenheit, or less than 36 degrees centigrade, or 96.8 degrees Fahrenheit, a heart rate greater than 90 beats per minute, a respiratory rate greater than 20 breaths per minute, or an end-tidal less than 32 millimeters of mercury, and a white blood cell count of greater than 12,000 or less than 4,000, or greater than 10% immature bands. Now, we're obviously not going to know that in the field unless a nursing home or something has drawn a CBC, and they have that for us. So we're going to go over some definitions. An infection, it's a presence of microorganisms in a normally sterile site. Bacteremia, cultivable bacteria in the bloodstream. Sepsis, the systemic response to infection. If associated with proven or clinically suspected infection, SIRS is called sepsis. So these two definitions are important because they are healthcare acquired. Nosocomial and iatrogenic are healthcare or hospital acquired infections. Cytokines are chemical messenger proteins in the immune response, and white blood cells, also known as leukocytes, are essential in the immune system. Now this is a table of the white blood cells. So we look at neutrophils, they kill bacteria, fungi, and foreign debris. Monocytes clean up damaged cells. Eosinophils kill parasites, cancer cells, and are involved in the allergic response. Lymphocytes help fight viruses and make antibodies. And basophils are involved in the allergic response as well. So severe sepsis has organ hypoperfusion plus one of the following: a systolic blood pressure less than 90, acute mental status change, a partial pressure of oxygen less than 60 millimeters of mercury on room air, increased lactic acid or lactic acidosis, oliguria, DIC or platelets less than 80,000, liver enzymes greater than 2 times what they normally are. Now, that's in comparison to MODS, or multi-organ dysfunction, which is sepsis with multi-organ hypoperfusion and 2 or more of the following. And it's the same criteria: a systolic of less than 90, acute mental status change, a partial pressure of oxygen. Now notice that is not an oxygen saturation, that is a partial pressure of oxygen less than 60 millimeters of mercury on room air, increased lactic acid or acidosis, oliguria, DIC, or platelets less than 80,000, and liver enzymes greater than 2 times normal. So this is the sepsis continuum. It shows you how things progress. So it goes from SIRS, which is a clinical response arising from a nonspecific insult with greater than or equal to 2 of the following, and then it goes over the criteria. And sepsis is SIRS with a presumed or confirmed infectious process. And remember, usually we're going to be presumed, not confirmed. Then it goes to severe sepsis, which is sepsis with organ failure, and then septic shock, which is sepsis with refractory hypotension. So you're treating it and it's not coming back up. So this shows the mortality rate with SIRS. And the mortality rate with sepsis is high. And we're trying to lower that, and I'll show you how we're going to do that in a little while. So here, with no SIRS, you're down at 3. If you're at septic shock, you're at 46. Severe sepsis at 20, sepsis at 16. And you can see those numbers in the middle. So this is showing you, again, the progression. And it shows you that there are other causes of SIRS that are non-infective. It shows burns, trauma, pancreatitis. But then over here, your infective causes, your viremia, parasitemia, fungemia, bacteremia. And then it shows your SIRS criteria, SIRS plus infection, sepsis plus end organ damage, severe sepsis plus hypotension, and then death. So, sepsis stages. Right here, this is showing you exactly what's happening with your vascular permeability. Cytokines being released from your white blood cells, and your vessels leaking. So, sepsis stages. Sepsis symptoms include fever, mental decline, and extreme illness. Severe sepsis when there are signs of organ dysfunction, and septic shock when the blood pressure drops. So, a normal response to injury and infection, and we're just going to kind of go over the basic premise. So, leukocytosis, neutrophils mobilize into the circulation. Tachycardia, so there's increased cardiac output and blood flow to the injured insult site. Fever, raising the core temperature, peripheral vasoconstriction shunts blood flow to the injured tissue. More often occurs when infection is the trigger for the systemic response. Then you go into the acute phase, the anti-infective, then the anti-inflammatory, which releases anti-inflammatory hormones such as cortisol, HCTH, and epinephrine, which reprograms the circulating leukocytes such as epinephrine, cortisol, etc. Then you go to the procoagulant phase, which walls off the infection and prevents systemic spread, which increases synthesis or releases of fibrinogen. Then you decrease the synthesis of protein C and antithrombin 3. Then you go to the metabolic phase, which preserves euglycemia, so normalizing blood sugar, mobilizes fatty acid and amino acids, and then thermoregulatory phase, which inhibits microbial growth. Risk factors for sepsis. There are a lot of them. Radiation and chemotherapy, long-term and aggressive corticosteroid therapy for organ transplants and inflammatory diseases, the elderly, neonates, use of invasive procedures and surgical devices, underlying disease such as neutropenia, COPD, diabetes, AIDS, and other chronic conditions, immunosuppressive drug therapy, catheters such as urinary catheters, abortion, burns, intestinal ulcerations. So what does sepsis look like in the field? So the number one cause of altered mental status in the elderly is urosepsis. So change of mental status, fever or hypothermia without a known cause, urinary problems, diarrhea, rash, tachycardia, shortness of breath, hypoxia, pain, chills, nausea and vomiting, fatigue, and the list goes on. There's a whole litany of things that can present which could be suspicious for sepsis or SIRS. These are the infectious agents. I just included these because there are a few that we're familiar with, so pneumonia, E. coli, Staph aureus. I'm not going to go over all of them because there are just so many out there. So what are some complications that you could go through with sepsis? ARDS, adult respiratory distress syndrome, DIC, which is disseminated intravascular coagulation, acute renal failure, intestinal bleeding, liver failure, central nervous system dysfunction, heart failure, and then death. So, we talk about the golden hour of trauma. There really is a golden hour of sepsis too. So once you identify that somebody might have sepsis, you want to start treating them aggressively within 1 hour. And here is what Surviving Sepsis has come up with. You want to get their blood pressure under control. You want to get their cultures. Unfortunately, we cannot measure their lactate, and it requires ice, so you have to put that tube on ice. But that can be drawn after you start administering antibiotics. But administer broad-spectrum antibiotics is one of the big things that they want to do within an hour of identifying possible sepsis. So that's something that we are beginning to do, and it's important that we actually follow through on. Maintain a MAP of 65, so there's our equation for MAP. So crystalloids of 30 milliliters per kilogram if we need to, vasopressors. So these are some things that are goals during sepsis management. Improve time to broad-spectrum antibiotics and early targeted antibiotics and source control. So really, we need to focus on getting those antibiotics on board as early as possible. Our goals: drawing cultures, MAP and blood pressure control, so fluids and pressors, blood sugar control, antibiotics, and antipyretics, so acetaminophen if we need to. So if you have any questions, contact me, and thank you very much.